my people, welcome back to my channel, and thank you for the love that you're showing me, and my family is growing, the YouTube family is growing. Thank you so much. Yeah, and we've started a series on pregnancy. So anyone who's pregnant, you're planning to be pregnant, you're planning to impregnate your chick or your wife, it's high time you come here. We are going to give you tips. So today I have a special guest. She's a nutritionist. She's called Makena, and she's going to take us through pregnancy and nutrition. Welcome, Makena. You can introduce yourself.
Thank you, Linda. My name is Makena Misheni. I am a nutritionist with over 6 years experience in community nutrition, nutrition assessments, research and monitoring and evaluation. So, and I'm glad to be here.
Okay, so we can start our topic. Yeah, so in the recent past, I've seen like people talking about nutrition and pregnancy. There's been so many campaigns about nutrition and pregnancy.
Yeah.
So why do you think like nutrition is important in pregnancy?
So 80% of how you look, your weight, your presentation, your image is a representation of what you eat. And more so now in pregnancy. When you're pregnant, it means you're carrying a human being. You're developing a human being. And basically what this means is the baby feeds on what the mother is eating. And so your nutrition is important during pregnancy. Why? Because one, it ensures that you're able to deliver a healthy baby in terms of weight gain, in terms of the weight the baby has and the mother has. And of a malnourished mother will definitely give birth to a preterm baby or an underweight baby. And underweight babies' chances of survival are very minimal. And so your diet really depicts how you're going to survive, the survival rate of the baby and the survival rate of the mother. The second reason why nutrition is important is because in terms of managing the symptoms of pregnancy, where be it nausea, be it vomiting, there is a way you can nutritionally manage it. Yeah. There is a way you can know how your moods are happy, how your moods are changing, and be able to manage it with your diet. The other thing is there are specific nutrients that are important in the body. And here allow me to talk about the 1,000 days of a baby, of life, the 1,000 days of life. Now, the first 1,000 days of life are very important. Why? After these 1,000 days, if a child has not gotten specific nutrients, there are some irreversible changes that happen that even if the mother tries to eat as healthy and so on, the damage has already been done. Yeah. And these 1,000 days comprise from the time the mother is pregnant until 2 years of age. So nutrition is important for the 9 months of pregnancy, year 1 and year 2 of the life of the baby. If a mother lacks specific nutrients, for example, if the mother does not eat adequately, if the mother is consistently malnourished, she will deliver to an underweight baby. And an underweight baby, 50% chances, survival rates are very low. If this child survives, the child will be of low weight, and even development of this baby will be a challenge. Even development of the brain. And that is why you find that even in performance in school, this baby takes a longer time. And that is why a mother needs to be very careful when she's pregnant, the nutrients that she's taking. Yes, and I'm sure we'll be definitely, as we go along, we'll talk about the specific nutrients.
So guys, you've seen the importance of nutrition in pregnancy, yeah? And by nutrition, you just mean the food that you're consuming, yeah? You've seen it determines a lot, especially the first 1,000 days of life. So we can go into now these types of food that someone is supposed to eat, especially the minerals, because I've seen some people usually ask me, maybe they go to a doctor and then they are given these supplements to take, maybe Pregnacare. I'm not trying to promote you because that's the common brand. So you can just talk about now the common nutrients nutrients, the best nutrients that actually a pregnant mother needs, so that people out there, when they're given supplements, they take them religiously.
Okay.
Yeah.
So now you're forming a baby. The first 3 months usually don't even show. Actually, even your caloric intake, that is your carbohydrates, your present, they don't really change. A lot of changes are happening in your body in terms of hormones, and then that is why in the first 3 months are usually the hardest. Because there is nausea, there is vomiting, there is morning sickness, and let me clarify. Morning sickness does not only come in the morning.
Oh, really? It's usually like not in the morning?
No, it varies. It depends with different people. For myself, my morning sickness used to come at 4 p.m.
What?
There are guys, their morning sickness comes at night.
At night.
And there are people, their morning sickness comes in the morning. Okay. But basically what morning sickness is it's that nausea, and usually there's a lot of vomiting that is involved. And that is, for me, it was something I was not prepared for. But because of these changes that are happening, it's also very critical. This is the time the baby is attaching to the uterus, and the time that the baby is forming. And so there are specific nutrients that a woman needs to have. And the first one is folate, which is folic acid. And folic acid prevents neurotube defects. These are defects of the spinal cord and the neurons and the brain. And so when you take folic acid, actually, it's usually advised that when you're planning to get pregnant, 1 month even before you get pregnant, you need to be starting on folic acid. And so it prevents neurotube defects. And neurotube defects, if you actually get them, the chances of this baby survival as very small. And if this baby survives, you may have a long
issue with your brain and spinal cord
development will be affected. And folic acid is usually gotten from dark green vegetables, red meat. But because you see, Kenya we're actually graduated to middle income country, but we are still not there yet. And that is why it is usually given as a supplement. Immediately a woman gets pregnant and she goes to the clinic, that is the first medication she's put on. They are given iron and folic acid supplementation, I-fast tablets. And many women complain that, those tablets are even making it worse, the nausea, but you actually need it. The second nutrient that you actually need is iron. Now, iron provides blood. It
helps in development of the red blood cells.
Exactly. And now you're forming a new creature, a new baby, a new human being, and this baby is going to need blood. And so blood is important. If a woman survives pregnancy with low HB, it means that there are chances that, one, she may have excessive bleeding during pregnancy. And you know, even the process of delivery itself, there's some blood loss. And so you can imagine if you don't have enough blood as it is before you even deliver, by the time it gets to delivery, this baby
you'll have anemia.
Exactly.
And anemia is very dangerous. It can actually kill.
It actually kills. And so that is why iron and folic acid are important. But even to supplement in your diet, red meat is also rich in iron. Dark green vegetables are rich in iron. But if you're pregnant, you cannot escape those supplements. Let us just be clear. Iron and folic acid supplementation. The other nutrient that is very important is calcium. Now, calcium is important for formation of the bones and formation of teeth. Now, another thing that people don't know, when a woman is pregnant, this baby is not merciful. You know, this baby wants to survive. And so if the mother is not taking enough of this nutrient, the baby takes away
from the mother. It's true.
And you realize, like, I want you to think about this. Imagine like your grandmother or some elderly women you know in your village. How many are walking with
when they're bent?
They are bent. It's because chances are they delivered children, like 2, 3, 4, 5. And then they were not keen on calcium.
That condition is called osteoporosis.
Yes, it makes the bones porous. And if when you're pregnant, when you're at this reproductive age, when you're not getting adequate calcium, it will definitely come to affect you in your later ages. So you need to be very careful. And also, I need to point out that multiple pregnancies is also an issue. If a woman just delivered this year, next year you're pregnant again, what happens is the mother's nutrients are depleted. And that's why actually when your mother gets pregnant, she needs to space the pregnancy. Why?
For about how many years?
A year or two. But you need that space. Remember, even after delivery, this baby is going to breastfeed. For the first 6 months of life, this baby is dependent on your mother. So you need to give yourself like a year to recover the nutrients. Remember, this baby is taking the calcium, is taking, if you're going to deliver, is taking the iron. And so this nutrient you need as the mother. And that is why even another complication that comes in the trimesters, in the second trimester, women experience bleeding. Gums start bleeding. When you're brushing your teeth, you spit, you see blood. It's because the gums become sensitive. It's still because of calcium. So you just need to ensure that you're getting adequate supply of calcium. And let me tell you, I am a nutritionist, and we've been shying away from this issue of supplementation. But doctors and even your midwife or your gyne will tell you supplements are important in pregnancy.
It's true.
They are important. The other one is omega-3, and omega-3 are fatty acids. They are good for brain development and also development of the neurological system. And so you need omega-3, and omega-3 usually comes from fish. And avocados also have some omega-3. However, animal-based omega-3 is richer, is the best. And so, you know, the challenge is maybe I cannot afford fish every day.
It's true.
And that is why supplementation is important. Because the other thing is, as much as we're also insisting on omega-3, you get situations where the fish also has high risk of mercury. And you know, mercury is also another complication in pregnancy. So instead of overdoing the fish, just get the supplement. But in pregnancy, you actually need these supplements.
Can we get now the omega-3 from omena or something of the sort? Or omena doesn't, because I'm thinking
Sardines,
thinking of someone from maybe Kibera, someone who can't afford like to get fish every single day.
You can get from omena, but I still insist that for a healthy pregnancy, these supplements are not wrong as long as they're prescribed by a doctor. You just, you know, like you explained that I heard that this nutrient, and it's important. Why is omega-3 important? For the brain development of the baby.
For the baby,
For brain development of the baby,
So it reaches a point where you can look at a child, they are kind of slow or something of the sort. So that's why you need like omega-3. Although people say babies have different milestones, but it reaches a point you're just looking at a child and you're like, something needs to be done about that. So omega-3 really is important. So eat your fish, eat your sardines when you're pregnant. So let us look at now the different trimesters. So we realize that different trimesters have different nutritional needs. Maybe first trimester, second and third. So could you share some light on that? Do different semesters like actually require different nutritional needs, or is there a trimester that you have to eat so much of this and less of this, or just clarify that?
So the trimesters, basically it's the 9 months of pregnancy, and they are divided into three. So the first trimester is the first 3 months, which I've already talked about. It's when the baby is attaching. Sometimes when during this first 3 months, there are also chances of you losing the pregnancy, either because of a miscarriage, either because of a blighted ovum. A lot of things can happen. And that is why usually people don't even want to talk about pregnant.
I'm pregnant the first 3 months.
Because you don't want to tell people and then something happens. And so I've already talked about the key nutrients in the first trimester. That's the folate, folic acid, iron and calcium and perhaps the omega-3. So the first trimester, and the first trimester, if it's your first pregnancy, it's going to be, it's a crazy period.
Crazy, because you've never been there before.
You've never been there. A lot of hormones are going on in your body. A lot of things are happening that they're not showing outside, but a lot of things are going inside, internally. And the best thing, this is the time we need to support people.
Yeah.
And you know, as we're talking about pregnancy, we cannot shy away from teenage pregnancies that are happening.
Yeah, it's true.
And it is important that you support these women, these young girls at this stage. Yeah. There is a lot of nausea, a lot of hormonal changes that go on, and a lady really needs to be to be understood, to be supported. All of a sudden, there is a lot of intolerance on some smells of food, and you just need to understand.
Some types of food.
Yeah, like onions. Like when you fry onion, it becomes so annoying.
So annoying.
Yeah. But then, and there's a lot of, then there's the vomiting. You can't stand some food. You used to eat meat, you cannot stand the smell of meat. It happened. And I remember when my hardest lesson was when I was pregnant. I was like, nobody ever told me about
just to cut you a bit, you've talked about the nausea and vomiting.
Yes.
I understand that when nausea and vomiting is happening, someone might lose the nutrients. So how does, is there a way in which someone can nutritionally manage that? Or?
Well, mostly like 60–70% of the first 3 months, majority of women experience the nausea and vomiting. And nothing really much you can do. The other thing is the 3 most important nutrients I've said, they're the most important.
Okay, so it's just good for you to get the supplements.
Get the supplements, especially take the supplementations if you're given them.
Because
the vomiting, you eventually figure out a way around
or how to go about it.
Yes, but let me be clear that some women, it actually goes on for the whole pregnancy period. And so eventually you figure out that maybe this is the time that it hits me, so I probably eat earlier. So that when I eventually get, I'm not full.
So this is it. If you've ever been pregnant and you had like the morning sickness, please share what you did so that other people can know how to go about morning sickness, especially now the young mothers.
We need to
talk about this. Because they don't know what to do. In fact, if I get pregnant right now and I get morning sickness, I would not know how to go about it. So comment down below, let us know how you actually went about that. So we continue now talking about the 2nd and 3rd trimester with regards to nutrition.
So the 2nd trimester for me, okay, for majority, it's the breeze period. This is the 4th, 5th, and 6th month of pregnancy. This is when now the baby is starting to show, the morning sickness has gone, and now it's now starting to sink that you're pregnant. And then you'll notice that in the 1st trimester you rarely gain weight, but from the 2nd trimester you actually, there is tentatively you gain like 1 kg per month. It goes on like that, and it's okay. The other thing is the baby now is forming. By the end of the 2nd trimester, you will start feeling some kicks and some movements, and so on and so on. And so it's important. At the 2nd trimester now, here is where now we encourage the additional of calories. You can now up your food intake. If you're probably taking 3 meals in a day, you can maybe now incorporate maybe an extra cup of porridge, an extra food, because also the demand, the cravings now kick in. The cravings kick in, and usually you even notice that even as the baby starts kicking, moving around, they react to a specific food that maybe they like. But also now, because also the baby is now starting, because the baby is growing, they're pressing on the bladder. So then now there's frequent going to the washroom, and then also there is a lot of heartburn and indigestion. You feel a lot of heartburn, especially after eating food. And basically management, there are things you just can't run away from. Management is basically try eating small frequent meals. If you prefer to take a large breakfast, divide it into 2. Take half of it in the morning when you wake up, and then do the bits probably at 10. So your 3 meals, then they become like 5 meals in a day, small frequent meals. And then you ensure that at night you probably have your dinner slightly early, probably 7, 8, so that then when you're going to bed at probably 9, the food has already gone down. Because immediately after you eat and then you rest, then it also exaggerates the heartburn. Another thing that happens is also that you may develop hemorrhoids, and this does not happen to everybody. But because of the pressure of the baby, and this goes on to late second trimester to third trimester, as the baby is growing, then there's a lot of pressure on the pelvic, and also you start feeling pains on your hips, some lower pains, and that is also because your body is preparing for the birth of this baby. Yeah, and also another thing, also the sleeping pattern changes, because now the baby is becoming bigger. You'll find that even bending down to pick something,
it's a problem.
It becomes a challenge. And
you
then
can't even bend to tie your shoe.
No, you bend, and then you're like,
there's something.
There's some pain.
Yeah. Even I observed there's a pregnant lady I saw. The legs were actually having scales. Then she told me, I cannot even bend to wash my legs, even to apply oil. So it's relatable.
Here is where now the supportive husband comes in. But then the biggest change is when now even sleeping becomes now, it changes. You can no longer sleep comfortably on your back because the weight of the baby starts pressing on you. And then eventually you realize you need to sleep on the side. And I'm saying this because there's some girls who just don't get this information. They are probably hiding this pregnancy. You don't know, maybe a first pregnancy is usually the most complicated. And so you may find all these things you just figure out along the way, and majority come to speak about it later, on the 7th month, when you're already in your third trimester.
Okay, now third trimester nutrition, because this is where I see people gain a lot of weight. What really happens? Because I see people craving a lot of carbohydrates, like bread. People apply layers of blue band on bread. And what really happens in the third trimester?
It's that crazy. Now the baby is preparing to come out. The baby needs to be of ideal weight. So the third trimester is basically when the baby is just, adding some fat so that now they come out okay. But now in terms of the nutrients, you've already catered for the most important nutrients. Because the baby is still gaining weight, the third trimester, the mother also gains a lot of weight. And also in the third trimester, it's important to note that some complications develop. And here we are talking about hypertension, pregnancy-induced hypertension, which is
hypertension is high blood pressure.
Yes. High blood pressure in pregnancy. You never had it, but now when you're pregnant, or then suddenly and you start developing a complication, you go to the hospital, doctors say your blood pressure is high. It is induced by pregnancy. Because this is because of the increased blood flow, the increased weight gain, and so you have to manage it. You have to manage it by.
So what I'll do a video specifically on preeclampsia and eclampsia, high blood pressure in pregnancy, so that you can actually know how to go about that.
The other one is also gestational diabetes. That's also something. You never had blood sugar problems before. Now you're pregnant, you go to the hospital, the doctor says your sugars are high. And this is usually associated specifically with overweight, too much weight gain during pregnancy. It may go away, it may stay. But all these conditions, they are chronic, they are long term. And the only way you manage it is by your diet. And I'll still go back to the same thing. Whenever you're talking about nutrition, it's basically about your moderation. You're not overdoing a specific thing. Even if you feel today I've eaten ugali, tomorrow ugali, another, and
you'll even get bored.
You actually notice that you're overdoing this thing, and eventually it starts to manifest, and it manifests in conditions, diseases, lifestyle conditions.
So since you've talked about now people gain a lot of weight, does it reach a point, or can someone be actually obese when they're pregnant? And at what point do you say now, hey, I've gained a lot of weight, I'm obese, or I've gained a lot of weight, I'm okay?
So the first thing is, before even a woman gets pregnant, you know your weight. If you're overweight before you get pregnant, try to lose it.
Lose your weight.
Because during pregnancy, we don't encourage losing weight. Whenever immediately you get pregnant, you can forget for the 9 months. You can forget any activity of losing weight. But this does not say we don't exercise. Exercise is important in pregnancy. You cannot just stay in the house. Exercise is important, and because your body is changing. And if you do not exercise, if you do not put that excess calories to work, eventually it will get you down, even after delivery. And that's why there's a lot of depression. And actually another thing I had forgotten, omega-3, because it helps with brain development, it is also very important in women, 2nd trimester and 3rd trimester, because studies have shown that women who actually have enough omega-3 supplementation, they have minimal cases of postpartum depression. Depression happens. And you know, depression even happens in pregnancy. In 2nd trimester, your clothes are not fitting.
And you realize that you're gaining a lot of weight.
Today you're wearing your favorite jeans, tomorrow it's not even fitting. And maybe you don't even have that budget
to buy extra clothes.
Or you're still holding on to the fact that I don't want to gain weight. So there's some depression that comes. But when there is adequate supplement and a lot of support, I cannot overemphasize this. Psychological
so parents, people out there, spouses, sisters, brothers to a pregnant person, make sure you support them mentally, because
it's important.
It's important, because mental health is really important when you're pregnant, because if you're not okay, you might end up harming yourself and the growing fetus. So it's really important about that.
So about obesity, now if you've gained it, so before you get pregnant, try not to be overweight. But if it happens, you're not losing weight, just have to ensure that you're exercising. And there is so much content so far. This COVID period, people have a lot of internet access in their house. There are a lot of YouTube videos on working out. Even at
during
home.
pregnancy.
You don't need to go to the gym. You don't need to go out walking everywhere. You can comfortably work out in the house. You know, just make an effort that every day you've put in 30 minutes of exercise. Just make that effort. It goes a long way. And even for women who are planning maybe to deliver normally, you need to exercise a lot so that the pelvic bone then is okay. And there are a lot of even pages on Instagram, on social media that you can follow, on women that have really have gone through the pregnancy with exercises. Exercise is important. It's important in pregnancy. During pregnancy, if the woman is overweight, chances are she may give birth to a big baby. And a big baby is basically 3.5 and above kgs. What the problem is with this, one, this big baby, they will develop well, but chances are when they are growing up in their teens, they are likely to be obese also. They are more predisposed to lifestyle conditions like hypertension and diabetes. That's a challenge.
So it's really important that you watch your weight during pregnancy. Look at your weight and the ideal weight that you're supposed to gain during pregnancy, and make sure you just don't go past that. And then another thing, pregnancy comes with a lot of weight gain. And I see like people, when they've actually given birth, they have a lot of issues with losing their weight. Look at these celebrities who go for tummy tucks after pregnancy, and then you want there to look like Kim Kardashian after delivering. No, it's normal. Take your time. Let no one force you to lose your weight. Take your time. Concentrate on the baby. Weight loss will come later.
The weight gain a woman is supposed to gain from during pregnancy is 12 to 15 kgs on average. 12 to 15 kgs. So if you're probably 60 when you got pregnant, at delivery umechezea hapo up to 85 on the maximum. Mostly. And let me tell you, the weight gain is important. And some people even gain weight even in the first trimester. And this is because of increased blood and increased body fluid. So the weight gain is not only the fat, it's also the blood, fluid, it's the body fluid, it's the baby,
it's the weight of the baby, even the placenta
and the amniotic fluid. So it's not a big deal. If you're carrying this baby, let's not overstress about weight.
So guys, I hope you enjoyed this video. If you have anything to do with nutrition and pregnancy, leave it in the comment section. And if you liked this video, make sure you give it a thumbs up, and make sure you share so that we can reach a wider view, so that many people who are intending to be pregnant or are pregnant can gain from this. So thank you so much. I hope you'll subscribe to my channel. COVID has spoiled a lot. Things are thick, so please subscribe to my channel. Thank you, and I'll see you on my next video. Bye.
Bye.